Good afternoon, everyone. As we are seeing a resurgence of cases of COVID-19 in our community, I wanted to take time to provide everyone with an update. We're entering the second consecutive week at a level of substantial spread of community transmission in Northampton County. In addition, Monroe County has now moved from a moderate rate of spread to substantial. I anticipate a meeting will be held on Monday morning with all our school leaders in IU-20 region, Department of Health, and the Department of Education. Until then, after careful consideration and discussions with superintendents of school districts, at this time, we will all maintain our current instructional model until further notice. We will continue to partner with our superintendents, CTC directors, the Department of Health, and the Department of Education on their recommendations. There are a number of variables that we are considering in making decisions regarding the instructional model being provided in our schools. First, when cases are reported to the school closely examines if the positive cases come from the same household. Second, if there are multiple cases that are in the same classroom or school building, which could determine if there is spread. And third, who may have come in close contact with the person that tested positive. The fourth thing we look at is when was the last time the person that tested positive was in school? And fifth, what were the actions of the persons that tested positive, as well as the actions of their close contacts? And when I mean actions, I mean things like, were they wearing their mask? Were they keeping social distance? In addition, we also look at where within the county are the positive cases being reported. Just because the county is overall at substantial, it doesn't mean that that particular school community within that overwhelming county is largely being infected. I also want to be clear that there is overwhelming research from medical professionals and other county health departments. They're reporting that they are encouraged by what schools have done so far in managing the pandemic. The commitment to the preventative measures in schools continues to be paramount. Also, there is no existing evidence anywhere indicating that in-person schooling contributes to spread in the community. Furthermore, there's no evidence that closures alone will slow the spread in the community. Unfortunately, Northampton, Monroe, and Pike counties do not have their own county health department. However, county health departments in our surrounding region are in support of schools continuing their instructional models. In addition, these county health departments share that when considering changing instructional models, it is important to consider information such as the following: the number of COVID-19 cases and outbreaks, evidence of transmission within the schools, staffing levels, and adherence to preventative measures. Since the start of the school year, we've had 7 positive cases of COVID-19 in our intermediate Unit 20 programs, six which were staff and 1 that was a student. We need to be aware that in various regions, cases brought to school have been traced to exposures outside of school, most commonly household contacts and social gatherings and situations where the involved cases were not masking appropriately. This is the reason Secretary Levine, health professionals, and I continually say wear a mask, wash your hands, monitor your symptoms, and engage in social distancing. Please be aware that conditions are constantly changing and may require a school building, school district, or intermediate unit program to move to full remote instruction, either in short or long term. And I think many of us have seen this in our various school districts, where some school buildings have been closing for a short period of time. As positive cases continue to increase in our community and our staff are exposed to potential cases, staff will need to quarantine at home. Therefore, we may need to quickly shift individual classrooms from in-person to remote to make sure that we're providing consistent education. The decision to shift from in-person to remote in these unique situations may occur without advance warning. These decisions may have to be made early in the morning prior to school starting. So we encourage everyone, staff, students, and families to be prepared and to have a contingency plan in place for such an event. Last, if you're not aware, today is World Kindness Day. On this day, we highlight good deeds in our community, focusing on the positive power and the common thread of kindness which binds us. During the COVID-19 pandemic, it is even more important for us to be kind to one another. The global pandemic has been challenging and stressful for everyone. A random act of kindness can give a huge positive impact on someone that is having a rough day. So let's use this day as a reminder to be kind, not just today, but every day. Give someone a compliment today. Write a handwritten note to a family member or friend. Hold the door open for someone. Smile. Say thank you. Offer to help someone. Let's continue to spread positivity throughout our community. We truly recognize the challenges this pandemic has created for everyone. Our decisions continue to be made in the best interest of our students, staff, and community. During this very challenging time, thank you for your continued hard work, patience, understanding, and support. I wish you all a nice, relaxing, and healthy weekend. Take care.